Hello, and welcome to our analysis of healthcare in France. We understand that you are looking to establish an international presence and want to learn more about the health issues and healthcare system overall in France. Here's our consulting team. We are a multidisciplinary team of healthcare, education, and policy experts. With a proven track record of working with top tier institutions on international ventures, we take a tailored approach to address client-specific goals and challenges. Now, why choose our team? Well, it's really because our team shares expertise, knowledge, and experience. We share expertise in international education and campus planning. We have knowledge of global healthcare systems and workforce health strategies, and we have experience in supporting U.S. universities in cross-border expansion. All of this combined really makes us the perfect partner to launch your new campus in France with, and you'll see that throughout this presentation. Now, let's talk about you, Atlantic Coast University. With your mission to foster global education, innovation, and cultural exchange, we have a new objective together, and that is one that is to expand your international presence with this campus in France. And this is something we, as a consulting team, are very eager to assist you with. As we look to work together on this international expansion, what are we hoping to accomplish? We are hoping to align the French campus with ACU, understand local health systems, and ensure seamless integration. But what does that really mean? We need to align this new campus with ACU's academic excellence and cultural values that you currently hold. We also need to understand local labor laws, healthcare systems, and employee wellness needs. And finally, we will ensure a seamless integration of US and French standards.
Hello, my name is Samira Razayan, and I am a consultant that will be discussing primary market and secondary market research. To effectively assess the suitability of establishing an international campus in France, we propose utilizing three primary market research methods: interviews and surveys, focus groups, and local partnerships. These methods will provide both qualitative and quantitative insights into the local healthcare system, workforce needs, and community expectations. On the left-hand side, we will be beginning with the interviews and surveys. These tools are essential for collecting direct feedback from key stakeholders such as healthcare professionals, potential employees, and local residents. Interviews offer in-depth qualitative insights into individual experiences and perceptions, while surveys allow for broader data collection and trend identification. Combining these methods ensures a well-rounded understanding of local healthcare challenges and cultural considerations. In regards to the focus groups, by gathering small groups of participants to discuss health-related topics and community needs, focus groups facilitate dynamic interactions that can reveal shared attitudes, cultural nuances, and potential barriers. This method is particularly useful for exploring complex issues and generating detailed feedback that can guide decision making. Collaborating with French universities, healthcare providers, and other organizations is a critical strategy for assessing expertise and building credibility. These partnerships can help bridge cultural and regulatory gaps and provide valuable insights into healthcare practices and workforce expectations. They also foster long-term collaboration, ensuring the university's operations align with local priorities. To guide decision-making on establishing an international campus in France, we will rely on high-quality secondary market research using diverse data sources and focus on key healthcare metrics to provide actionable insights. Along the left-hand corner, we have data sources, and under this column entails the World Health Organization reports, also known as WHO, that involve publications which provide a comprehensive overview of France's healthcare system and emphasizes system global benchmarks and public health statistics in France. French Ministry of Health publications have official reports from the ministry which offer localized insights into healthcare policies and public health initiatives to better understanding regulations and workforce trends. Peer reviewed academic journals involve scholarly articles which offer in depth analysis of healthcare trends and workforce challenges with evidence based studies. European Union Health Profiles by the European Observatory of Health Systems and Policies provides detailed country health profiles, including data on healthcare financing, quality, and outcomes, as well as benchmarking France against other European Union countries. Next, we will talk about key metrics. Prevalent diseases is important because data on chronic conditions such as cardiovascular disease, diabetes, and mental health challenges are essential for understanding the healthcare needs of employees in the community. Quality and outcomes of care involve metrics like life expectancy, disease survival rates, and patient satisfaction, which can provide a clear picture of healthcare system effectiveness. Healthcare's cost involve analysis of per capita healthcare expenditure, out of pocket cost, employer sponsored benefit cost, which can ensure that financial planning aligns with employee expectations and regulatory environments. Healthcare accessibility is also an important key metric. This can involve average wait times, availability of specialists, and regional disparities, which can help assess the feasibility of providing equitable healthcare for university employees.
Hello, my name is Aisha. I will be presenting on healthcare quality, costs, accessibility, and equity. French are known to be relatively healthy. Life expectancy in France is higher than other European countries by 1.5 years, with women living 6 years longer than men. One risk factor in France is cancer, which is the leading cause of death. Following cancer, there is an issue of circulatory diseases such as stroke and heart diseases. Mental illness also affect more women than men, and they include anxiety, depressive, and bipolar disorder. People are also at risk of environmental behaviors such as smoking, tobacco, alcohol consumption, and low physical activity, and air pollution as well. Unfortunately, this year, whooping cough has made more French people at risk. According to Santé Publique, this resurgence has been the worst in 25 years. At least 35 people, mostly young people, have died from whooping cough this year. French does particularly well when it comes to preventive care. It has one of the lowest mortality rates when it comes to treatable diseases, and hospital mortality rate is between 8.4 and 9.9 deaths per thousand people, and infant mortality is 2.617 deaths per thousand lives birth. Although those numbers have decreased, but they're still better than some European countries. France is a leader in medical technology with a focus on innovation and research. It is the second largest medical device market in Europe. Some fields of operation include optical technology, scar management, and surgical robotics. In the hope to enable everyone to play an active role in the healthcare, France has created Mon Espace Santé, which translates to My Health Space, in 2022. This electronic health record was designed to meet patient needs throughout their entire lives. So, from child, from birth to elderly care, patients can find out when they're due for a vaccine, and also send messages to the doctors. Monespa Sante also helps providers save time Instead of switching from one tool to another, they just use this app to send everything they need for the patients. They can send prescriptions, retrieve healthcare history, and lab results. France has a mix of public and private run facilities. The public ones are called hospital, and the private ones are called clinic. According to the World Health Organization, France has about 3,800 healthcare facilities back in 2020, and about 45% of those are public, while 33% are private for profit, and 22% are private non-profit hospitals. Healthcare professionals are held by a system of strict regulations. They must be licensed, go through continuous professional development with an emphasis on quality and safety. The Haute Autorité de Santé (HAS), which is an independent public institution that is tasked to ensure quality in healthcare and social services. The organization advises on best practices for healthcare professionals and social care professionals, and they make sure that practitioners are certified or licensed. All practitioners must be registered in the Répertoire partagé des professionnels de santé, which is a central directory for identifying doctors. So if patients need to find doctor, they just go into that directory, and every practicing doctor should be registered there. Healthcare in France is relatively affordable due to the universal statutory health insurance. France has the lowest share of out-of-pocket expenditure in Europe, according to the World Health Organization. French pay for health insurance by employees, employers, distribution, and a national health, health income tax. We will go more into detail in the next section. Um, the system covers hospital stay, physicians, and long-term care, and about 95% of French have private insurance, which they use to supplement anything the universal health insurance does not pay, and they use it for like dental or vision expenses. Um, a patient will pay about 25 euros to see a general practitioner, and between 40 and 60 euros to see a specialist. And the health insurance will take care of the rest. Um, Public medical school in France are almost free, and which is a big difference than medical students from the USA. Um, the malpractice insurance is also lower in France than in the USA. The problem of medical deserts in France has progressively worsened over the last decade. These areas are characterized by the lack of shortage of healthcare professionals, which make it challenging for residents to access medical services. Individuals in these regions frequently face long wait times to see a general practitioner or a specialist, resulting in a significant disruption to patient care. Additionally, medical desert place added pressure on hospitals as patients often rely on emergency care, contributing to overcrowding of those hospitals. Access to care also varies by social economic areas. Low-income areas have poor access medical to quality medical care compared to higher income areas. Healthcare in France is fairly equitable and comprehensive. The system is a national health insurance model that provides universal coverage for its citizens, although cost sharing is required for some services. It also does not cover dental or optical services. The system covers everyone regardless of employment status, and also it covers immigrant and undocumented immigrants. And they do that to a public agency called Ed Medical Data, or the AME. Um, Immigrants can get primary, secondary, or even tertiary medical care, although there are some restrictions depending on the immigrant's status and how long they have been in the country. The coverage includes many services such as hospital care, maternal and newborn, diagnostic care services, and long-term hospice care.
The state's healthcare system in France is called the Assurance Maladie, and it is a key branch of the overall state's social security system, La Sécurité Sociale. The French healthcare system is structurally based on a social health insurance approach, but it also shares national health system goals reflected in single payer module. The system is primarily funded through a combination of public funding, employer contributions, and private insurance. Back in 2000, the World Health Organization ranked the French healthcare system the best in the world. The system is largely publicly funded, with approximately 70 to 80% of healthcare costs covered by the government, which means that the system covers most costs for hospital, physicians, long term care, as well as prescription drugs. Patients are responsible for coinsurance, copayments, and balance bills for physicians' charges that exceed the covered fees. This public funding comes from a mix of mandatory payroll taxes, which are imposed on both employers and employees, as well as other specific taxes such as those on tobacco, alcohol, and insurance premiums. These contributions ensure that citizens and legal residents have access to necessary healthcare services, including medical care, hospitalizations, and prescriptions. A unique aspect of the French funding model is the complementary health insurance. Up to 95% of citizens have supplementary insurance to help with these out of pocket costs, as well as dental, hearing, and vision care. Private insurance covers the remaining 25% of healthcare costs not covered by Sécurité Sociale. Many employers offer complementary health insurance to employees, which helps cover additional expenses such as copays or non reimbursed treatments. As such, the French operates under a hybrid system that blends universal public healthcare with private supplementary insurance, creating a balance between state coverage and individual responsibility. So let's talk about your contributions as an employer. Employers in France are required to contribute to the healthcare system through mandatory social security payments. These contributions are calculated based on employee salaries, and the rates vary depending on the type of employment and the size of the company. Employers pay a significant portion of the social security taxes, including the healthcare component, which covers not only medical care but also maternity leave, pensions, and other social benefits. In addition to the social security contributions, employers also provide complementary health insurance, or mutuelle, as part of their employee benefit package. In 2016, the French legislation mandated that all employers offer a basic level of complementary health insurance to their employees. This helps mitigate out of pocket costs for employees and ensure that they are covered for treatments not reimbursed by the states. These employer contributions are crucial in maintaining the accessibility of healthcare services for all residents, especially in a country where healthcare is considered a right. For a US company considering expansion into France, the healthcare system presents both opportunities and challenges. particularly when considering political stability, economic growth, and the demand for healthcare improvements. Looking at political stability, France has a strong political environment with a well established healthcare system, governed by a mix of public and private entities. The political structure provides a stable environment for businesses to operate, with clear regulations surrounding the healthcare sector. The French government is committed to maintaining universal healthcare access, making the country attractive for businesses looking to collaborate with public health entities to provide health related services and products. When it comes to economic growth, France is the second largest economy in the European Union, and it has shown consistent growth over recent years. With an aging population, increasing life expectancy, and a focus on improving healthcare delivery, the demand for healthcare services is expected to rise. The French government has also been investing in healthcare innovation, focusing on digital health solutions and modernizing healthcare infrastructure. This creates ample opportunities for companies that offer innovative healthcare technologies, medical devices, and digital solutions to enter the market. Lastly, the demand for healthcare improvement. Although France has a strong healthcare system, there are areas that require improvement, such as reducing waiting times for certain procedures, enhancing the quality of care in rural areas, and integrating digital health solutions. With healthcare costs continuing to rise, there is a significant demand for cost effective solutions that can improve the efficiency of the healthcare system without compromising the quality. However, challenges do exist. The healthcare system is highly regulated, and US companies would need to navigate a complex regulatory framework, which can be time consuming and costly. Furthermore, there is a strong competition from local firms and European companies with established relationships with the government and healthcare providers.
We conducted a SWOT analysis of establishing a campus in France. The strengths include France's universal healthcare system, which ensures comprehensive employee coverage, and its political and economic stability, creating a favorable environment for investment. Additionally, France has a highly skilled workforce and a well-established educational infrastructure. Weaknesses primarily lie in regional healthcare disparities, particularly in rural areas, and challenges related to cultural and administrative differences that may arise during integration. Opportunities are vast, including leveraging France's robust digital health sector and meeting the increasing demand for educational and healthcare advancements in underserved areas. However, we must remain vigilant about threats, such as potential resistance to a foreign institution entering the market, evolving healthcare policies, and regional disparities in infrastructure. This analysis highlights the strategic considerations essential for a successful expansion into France. While the opportunities in France are significant, there are notable challenges to address for Atlantic Coast University's international expansion. Firstly, navigating complex regulatory frameworks will require a deep understanding of both French labor laws and higher education policies. Compliance will be critical to avoid operational disruptions. Secondly, addressing the disparities in healthcare access, particularly in rural and underserved areas, presents a unique challenge. These disparities could impact faculty recruitment and employee satisfaction, particularly for those in regions classified as medical deserts. Additionally, cultural differences in work-life balance and expectations for employer-sponsored healthcare could pose challenges in integrating U.S. institutional standards with local practices. Lastly, competition with local universities for top talent and partnerships may necessitate innovative strategies to establish Atlantic Coast University as a valuable contributor to the French educational landscape. These challenges underscore the importance of careful planning, cultural sensitivity, and collaboration. To successfully establish an international campus in France, we recommend focusing on several key strategies. Forming partnerships with local universities and healthcare providers will be essential for building credibility and accessing resources that ensure a smooth integration into the French education and healthcare sectors. Additionally, leveraging France's commitment to digital health innovation by incorporating telemedicine and other digital tools can help bridge disparities in healthcare access, particularly in underserved regions. Offering tailored benefit packages such as supplemental insurance and wellness initiatives will attract and retain top-tier talent while addressing regional healthcare disparities. To further support integration, we suggest implementing cultural competency training for faculty and staff, equipping them with the sensitivity and language skills necessary to navigate the nuances of French society effectively. Strategic recruitment efforts should also prioritize addressing talent shortages in rural areas, offering incentives like housing assistance and professional development opportunities to draw skilled professionals to these regions. In conclusion, these strategies will position Atlantic Coast University as a leader in cross-border education while aligning with France's healthcare priorities and cultural values. By embracing innovation and collaboration, ACU can successfully establish its presence and make a meaningful impact in France. Thank you for the opportunity to present our analysis and recommendations. We look forward to supporting the realization of this exciting initiative.